Treating shoulder arthritis starts with a proper diagnosis of the cause of arthritis, as there can be multiple reasons. We do have proven treatments to help you, whatever the case may be. A common cause for shoulder arthritis is osteoarthritis, also called degenerative joint disease. This typically occurs from wear and tear over years on the protective cartilage at the ends of the bones. Another possible cause is referred to as posttraumatic arthritis, where often a patient has had multiple injuries or dislocations, for example, and the shoulder joint no longer functions normally. Similarly, another cause is when a rotator cuff has been torn for a significant amount of time, resulting in rotator cuff tear arthropathy. The cartilage in the shoulder joint typically wears out because the rotator cuff cannot keep the joint centered properly. For these more common causes, such as osteoarthritis, our first line of treatment is often physical therapy and anti-inflammatory medications such as ibuprofen. We may also add injections of steroids or biologics like platelet-rich plasma or stem cells to the treatment plan. Physical therapy, anti-inflammatories, and injections are typically very effective, and in some cases we may also be able to perform an arthroscopy, which is a minimally invasive surgery, to clean up the torn tissue in the joint and to help ease the shoulder symptoms. A cause that we see less of is inflammatory arthritis, such as rheumatoid or psoriatic arthritis. For this, often you'd be first typically referred to one of our rheumatologists who would determine the correct medications for your case. In cases where physical therapy, injections, and medications do not control pain adequately and where function is limiting, shoulder replacement is an excellent option. Depending upon the nuances of the case, we need to determine what type of replacement will be most successful, either what is called a traditional or anatomic shoulder arthroplasty or a reverse arthroplasty. Fortunately, many cases of shoulder arthritis can be treated with a personalized plan that starts with physical therapy, over-the-counter anti-inflammatories, and injections. However, if these measures fail, we have excellent surgical options to both alleviate your pain and restore function to your arthritic shoulder. See one of our UCHealth and CU Sports Medicine orthopedic specialists to develop the right plan for your unique case.